education and career growth.
God did not give the white people or the black people less talents. No. By the time God said, go and take control, that means God, our Father, the Creator, had put all the abilities in us.
Family health.
No one should one day tell you that, hey, since you have diabetes, you should not take Caro. That's a lie. There's what you call portion control.
Finance and wealth.
Keep track of your spending. And part of the spending, of course, as we said, be able to separate wants from needs. That's secondary.
Leadership and governance.
There are people who take on the political aspect and try to water down important, significant decisions we leaders take for the good of this country.
Not forgetting parenting.
Now you're raising kids or children who are in a totally different time. You get it. Those days your mother would just give you an eye and you know this is a problem.
Hey, they are visitors.
And it's just there are visitors
and
around.
Mom gives you this eye, you know?
Yes.
Catch more of this every Monday to Friday at 9 p.m.
Oh yes, greetings to you, our dear viewer. Thank you so much for keeping it to Church of Uganda Family TV. First and foremost, apologies for starting in a little bit late, but well, we are here. This is Family Hour. Specifically, today we're going to be diving into family health, and it is the theme of today as a Tuesday, as you may know, always here in the evening. I want to appreciate you for being patient and being here with us. And today, we're going to look into self-care, specifically in antenatal care. And to discuss all this with me, here is Dr. Ruth Grace, BK, who is an obstetrician in the Ministry of Health and, of course, specifically Reproductive Child Health Department. Greetings, Doctor. Good evening.
Good evening. Thank you very much for having me here today. I'm glad to be here and share about self-care and antenatal as well.
All right.
Yes.
Very interesting. I understand time is not on our side, so we shall start immediately with the definition of what self-care could mean, specifically considering antenatal care.
Thank you. So I will just break it down in the most simple format. You know, most times when you have doctors on the show, you think we're going to be very medical. So
Yeah.
Today I'm going to break it down a little bit. So antenatal means is if you broke it into two parts, that's the ante and then the natal. Now natal is a word that refers to childbirth, to bringing a life into the world. Then ante is the period before you bring the child into the world.
Okay.
So that is why we call it antenatal. So if we're going to be talking about antenatal, a period within which a woman gets pregnant up to the time when she gives birth, that is what we describe antenatal as. Then, and we bring in a self-care component, is how best do you take care of yourself during antenatal. Now, most times mothers usually refer to antenatal care as, and when you come to hospital, they think antenatal care is all about buying my clothes for the baby, preparing for where I'm going to give birth from only. But it goes way beyond that, and that is why in this self-care month we're talking about antenatal care and self-care as well.
Okay.
Yeah.
Very interesting. Can you also break down those activities or what is done in self-care?
Good. So in self-care, it's a multitude. It's not only just about your physical health. It goes beyond how is your mental health doing during antenatal. Most times if you see a woman getting frustrated during antenatal period, it will carry on even after she has given birth. So things to sort that then. Then also the emotional part. Now, this is where sometimes the men say that women become very needy in antenatal. But the truth is that women don't become very needy, but emotional health is also very important during someone's pregnancy.
Okay.
And then the different aspects that someone can do to also get back. Physically, usually we recommend women to take some exercises. Now, that is part of self-care and feeling good about yourself. Now, most women think it is going to the gym. It is not going to the gym. It is just, we recommend
walking around.
Just walking. Women are supposed to be soft bodies, you know, and it is okay. That's how nature treats us to be. And we recommend that you have a walk at least 30 to 60 minutes a day if you're pregnant. That is all we recommend.
Okay.
That is part of self-care. When it comes to diet as well, what are you taking in? Most times in pregnancy, the women have cravings and they are saying, okay, I want to eat this, I want to eat that. Part of self-care is knowing that one, you need to eat. Some women don't eat during pregnancy. One, either they feel so full. Two is that they're actually sick and they keep throwing up. Throwing up is not a good sign of pregnancy, and women need to know that.
Oh.
I see you're in shock. Yes. So we actually treat throwing up in pregnancy. It's not normal to be there, and you're not putting anything into your mouth. It's and it can escalate into a condition that we call hyperemesis gravidarum. You don't have to say it, but that's a condition that actually can kill a woman during her pregnancy. So it's not normal, and I think even men should know that okay, yes, a woman may vomit when she's pregnant. Not all women vomit, so that doesn't mean that she's actually okay. And then you keep on saying mnanga I know lubutu naira kuba kolachi assessment kale okay, and the men tend to kwegumya no, it's okay nango wange yali akola bwatyo. No, so part of self-care is knowing that what I'm supposed to eat. And if you're a pregnant lady and you're out there and you're wondering, what am I supposed to be eating? Now, a pregnant lady, if you've been having 3 meals a day, breakfast, lunch, and supper, you add in snacks in between those meals. At least 2 snacks. That is part of knowing, okay, I love myself and this is what I want. A balanced diet doesn't go very far. You need the protein, you need the carbohydrate, and you also need the fruit to be added onto that, including also drinking some water as well. Now, some women say, I don't want to drink a lot of water because my baby is going to get a lot of water around them. There's all those myths, but we encourage at least take enough water. If you don't want water, you can take your juice and have that. That is all in the physical aspect. Emotionally, we always encourage women during the time of antenatal to have a caretaker. Now, that caretaker can be your partner, it can be your best friend, it can be your neighbor, but someone to check up on you and say, how are you doing? Are you okay?
Okay.
If you had a long day today, but you're pregnant and you're worried about maybe something, you need someone to always say, are you fine? And that is part of also saying, okay, yeah, this is self-care, I'm taking care of myself. And knowing when things are not going well. Most times in antenatal, there will be teachings to do with what can go wrong in pregnancy. It is important to know that. But most pregnant women choose to say, God will provide, God will take care of me. Very good. God has provided and taken care of you and brought you to the antenatal classes to make sure that you actually know what you're supposed to be doing and what could be an danger to your life and that one of your baby. So self-care also means that I need to know what can happen to my body that may be harmful to me and also in pregnancy. And how do we get to know all that is by also attending our antenatal care contacts. Uganda has increased its number of antenatal care visits or contacts from 4 to 8. At least 8, actually not just 8, at least 8. And most young people, or maybe not just young people, but most young mothers and also maybe older mothers, they have this thing like, why should I just go for antenatal for all those times? It's important. Why? Because during pregnancy, a mother is not only bearing only one thing as a baby. It is 2 lives at once. If you even have twins, it becomes even more riskier. If you have triplets, it's riskiest. And the higher the order of the babies that you have, when we say order in obstetrics, we mean the number of babies that someone has. So the number of babies that you have also increases the aspects of how dangerous this could get to you. And how do we know that you can help yourself during pregnancy to know what could be wrong with me or what could be right? And sometimes the pregnancy is all good throughout, and that is okay. So we encourage women to always go for their antenatal care visits. That's part of knowing, okay. And the first visit should occur in the first 3 months of pregnancy.
First
3 months.
Wow.
As soon as you miss your period like this, that's already 2 weeks of pregnancy. 2 weeks.
It's not too early.
No, that's not too early. You see, that's why we're here talking about self-care. It can't be too early. You have missed your period. The baby is growing. So as a mother is waiting to say, okay, maybe it's not true. Maybe sometimes my period misses. Wait another week. That is 3 weeks of what? That is 3 weeks old of a pregnancy. Then when she comes again, she's like, okay, maybe another week. That's already 1 month old. Okay. Now the baby grows the most important parts in the first 8 weeks of life. By the time a mother makes 3 months of pregnancy, the body is already fully formed. So, and most moms will not have, the bulge come out. Most moms will wait for the bump to come out. No, they're not going to you have the bump come out, it is actually not going to be there. But the time when you're actually not having the bump, that's the most critical time for your baby to grow. It's a time when, one, your body is deciding, is this baby okay or not? And that's why sometimes mothers end up with pregnancy losses, or what we really call miscarriages. Because the body is still deciding, is this okay or not? There are tests that people have to do. Now, some people think antenatal is all about tests. No. When you do those tests, you have to know what is the role of these tests. Sometimes we'll do a blood group for the partner and also for the mother. And this is encouraged throughout all pregnancies. You do the blood group. Why? We want to know, does the blood group of the father differ from that of the mother? And if it does, this can impact your pregnancy. On a different day, we can go deep dive into that.
Okay.
But it can impact your pregnancy, and then it actually can lead to miscarriages or even a baby dying on later, even if they have just been delivered. So that is something that we do. Apart from that, we even screen for your blood pressure. How high are your blood sugars during antenatal? Do you have any infections that may affect your baby? The commonest one that we know in Uganda is malaria. Now, most times when someone has been malaria in pregnancy, they will not know. It will not come as, I'm shivering, I have a headache, I have my joint pains, I have a fever. It may not come as that. It may come as a pregnancy symptom. Even a partner may not know that actually this is malaria. But when you come for your very first visit, we do screen for all that. We check your urine, take off your blood, we check how much blood levels do you have, because every time you have any complication, the first time we have met you, we make sure we correct that, and then we counsel you, and then you're able to follow throughout your pregnancy, even after you have given birth.
Okay.
Yes.
Wow. Now let's talk about the care, the use of technology. What tools are there? Are they even there? If you could.
The tools for antenatal.
Yeah, for antenatal care and all that.
They're in existence. I like that you asked this question, and you say, are they even there? That is true. Most women do not know that we have some of the applications available. The Ministry of Health has tried to provide a self-care application that has some components of antenatal care, reminders for women, like we have talked about. And it's even goes further to break down the different components of antenatal. When do you do what you do during antenatal? Those apps are very available. The self-care app is available and can be downloadable on Google Play Store. We also have different apps on the internet. If someone says, okay, I can access the self-care app. Now, this is for mothers who are in the urban areas. We need to know that part.
Okay.
So, because if you don't have access to internet, you can't have access to the app. So, but still, if you download this app and you're in an area with little internet access, you can still be able to track your baby's growth. Now, these different apps show you, how does your baby grow? What are you supposed to be expecting? How big is my baby right now? And those apps do not also prevent a mother from reaching out to a healthcare provider for care. So in case the app is saying, my baby is supposed to be kicking today, but I'm not feeling any movements, I'm like, is my baby okay?
But let me understand, how do you connect the app to the person?
The app to the person. So you put in the details. That's a good question. So you put in the details. The app asks you. Most women have period apps. That's for the menstrual cycle. Now those menstrual cycle apps, some of them have inbuilt pregnancy apps. The moment you miss your period, it asks you, are you pregnant or not? So you click pregnant, it automatically goes into like the pregnancy cycle mode. So when you click you're pregnant, it starts telling you, okay, this is what you expect. Then it asks for you the days. When did you last miss your period? And it will tell you, you're about 2 weeks pregnant. You're about 3 weeks pregnant. So when you put in those details, it's just telling you, at around 16 weeks, you should be feeling a baby starting to move if you have already given birth before. At 20 weeks, that is for a first-time mother, around 5 months of pregnancy, is when you should be feeling something moving a little bit. Now, most moms don't even know what that is. And if the application is telling you're supposed to be feeling this type of way, and you're not feeling that, part of self-care is reaching out to your healthcare provider and saying, hello, I think I am worried. And these days we know that many of our mothers are Google patients. They are AI patients. I got to know now there's AI patients. So they always ask those questions and they get so worried. And when they reach out, especially first-time moms, they reach out and then they are worried. They're like, oh my God, I don't know. The app has told me maybe it's supposed to be kicking. Now they expect a kick like for Ronaldo. It is not going to be like that, and it is okay because the body is also getting used to what a pregnancy is. It does not know. if someone has never had a pregnancy before, or even if someone has had a pregnancy before but has taken some time without getting pregnant, they may not recognize even a movement of a baby. And indeed, when you ask a mother, what is the movement of a baby in the very first month, you know what they tell you? They feel like the insects walking inside the tummy.
Oh.
That's what they're going to tell you. It's not going to be a kick. It's not going to be a whole punch and what? No. It is, I feel insects. I feel butterflies flying in my tummy. So yeah, they actually get the actual butterflies when they are pregnant. Okay. And then later, as the baby is getting bigger and bigger and stronger, that is when now you start feeling the punches, because now it's a whole human being that's above 2.5 kilograms trying to move in there and saying, okay, can I also figure out how my body works? Now, what we usually teach mothers in antenatal, and mothers also have to know this, that how I mentioned that the visits have to be 8. Now, these 8 visits were increased especially for the baby, not majority for the mother, for the baby. Most times we lose our babies in the last 3 months of pregnancy. This is known worldwide, and these babies are known as stillbirths. Now, those babies are usually lost in the last 3 months of the pregnancy, or what we say that the last trimester. We encourage mothers to know what the pattern of the baby is, and that is part of self-care. How does my baby move? The first doctor of the baby is the mother, and the mother should know that. And the first question the doctor or the midwife asks you when the mother enters into the delivery room or into the antenatal room, Omwana Samba. They ask the mother, because the mother is the first what? First doctor of the baby. The mother will always maybe know that, okay, maybe something is wrong here, but a bit more, or maybe my baby is actually very happy now. Mothers will know that, my baby kicks a lot when I eat. My baby kicks a lot when I don't eat. My baby does what? And not every baby is that same. Maybe someone has given birth before. So part of self-care is knowing how are my baby's movements, and then also knowing that, okay, in the last months of antenatal, I need to go for antenatal every 2 weeks. Every after 2 weeks, I am going for antenatal until the final time when I'm supposed to what? To be giving birth. And if the signs of labor don't even come the time when you're supposed to be giving birth, we encourage the mother goes back to the facility after 1 week, and then a plan is made. They don't leave the hospital. Okay. I like encouraging mothers to make a strong footprint sometimes when they go to the hospital. If someone tells you, go and come back and wait for labor, but you have reached the time you're supposed to be getting labor, and there is no labor pain, refuse to leave. Okay. Refuse to leave, because it is just known that the longer the pregnancy takes, the more the baby is more likely to suffer some harm. So in different countries, you'll find different times. They will say, okay, fine, the pregnancy can go up to maybe 42 weeks. Now, for us in medicine, we count weeks, but mothers and parents, they count months. So for us, 42 weeks or 41 weeks is already 10 months. So 10 times 4 is, mathematics for mothers is already 10 months. So, but then we say a pregnancy is supposed to be 9 months. So just a few mechanics like that. But okay, so if you reach your 10 month of pregnancy and you're at 40 weeks, in Uganda we'll say fine, we can push you another 1 week. In other countries, they can push you for an extra 10 days, and others an extra 2 weeks. In some other countries, they don't even accept you for you to go up to 40 weeks. They get a baby out earlier, like a week before that time. All that is to help the mother and the baby not get any complications that may arise that could have been seen during antenatal.
Okay.
Yes.
Can we also talk about the male, please? Maybe just in like
the
2-3
male
minutes.
involvement.
Male involvement.
Now, number 1 is Kasao. Here.
Okay.
I'll go straight to the point. Men play a critical role in women's pregnancies, just right from the start. The moment a lady realizes, okay, I have missed my period, or I am pregnant, the first thing she's going to do is ask her partner.
Oh, yeah.
I am pregnant. Now, the response the partner gives is what determines the whole course of the pregnancy. Now, if a partner is supportive from the word go and say it is okay, you don't have to be earning millions of money. You don't have to be earning I don't know what for you to accept just that one statement of being there. Now, emotional support. Again, a partner. If we had coitus together and now we have a baby, it is a 2 people decision, not one. You can't tell someone, nakugamba mire mpeke tezakola. Nakugamba tukolese kino tekyakola. It is 2 people that were involved to get a pregnancy. The acceptance helps a lot. also in restructuring her mind and saying, okay, fine, I'm going to be pregnant for the next 9-10 months. I need to think through what my journey is going to be. Now, also, for men, it takes a little bit longer to process. I don't know why. You can share with me. I don't know why, but they usually process like after 6 months later down the road, they're seeing a bump and they're like, okay, there's actually a child coming in. So, but for women, it starts way earlier. So when the man accepts and the woman says she's pregnant, it helps her in her brain to start preparing. And in that way, you also encourage the woman to even go to antenatal. Now, men who have accepted the pregnancy will encourage women and say, it's okay. Kati tugenda di mu ddwaliro. Another women you find coming very quickly or very early. In what? In antenatal. They will come because the partner is supportive of that. Not waiting and saying, maybe what? Maybe you're lying. But are you sure? Are you sure you're pregnant? I have told you I'm pregnant. I've showed you the results.
I don't trust.
You don't trust. The other thing is also getting involved in the tests that are done. Now, sometimes men ask themselves, what am I going to do in antenatal when I go there? One, the government has tried to establish platforms where you can walk in with your partner, if you are a male who is pregnant, and you're allowed to ask questions in regards to her pregnancy. You're also allowed to say, but okay, she is not well. Okay, she is well, because you have that platform. Two is that some places where you will go, there are mechanisms that different midwives are put in place, and also healthcare in charges. A woman who comes with her partner is actually seen first. It's a motivation for also the men, because they understand that most times men have to go and look for money to like after their families. They want to be in lines for a long time.
Oh, yes.
So they'll put you up, and then you'll go and you will have the antenatal quickly, and then you leave. It helps the man also know more about pregnancy. Like I have told you, men get accustomed later about the pregnancy. But if a woman comes early for antenatal with her partner, it helps the man understand, mchala ina pressure, mchala ina sukari. My wife has this, or my partner has this. The doctor said there might be a complication here and there. Or the way the baby is inside the tummy is a little bit different. Maybe we may think about a cesarean section birth. Maybe the baby may come out a different way. So that helps prepare you mentally for what is going to be the decision at the end, or even for any emergencies, knowing that if I'm told that if my wife tells me I have a headache, I won't tell her drink water, no. I'll tell her, let's go to the hospital. They told us headache may be a sign of what? Of high blood pressures.
Okay.
If she tells me that, for some reason, I feel like I have ulcers. Now, most women will have the ulcers in pregnancy. Ulcers is a sign of high blood pressure. But if a man does not know that, we'll just say, it's okay. How shall I have any ulcers? We'll just go and get for your syrup for ulcers. You'll take that, but in the actual sense, you're actually what? You're having a different condition.
Yes.
Or if she wakes up and she just collapses out of the blue. She's just on the ground. At that point, you're confused, you don't know what to do. But that's a sign that you need to take her to hospital early. So being involved in antenatal helps men also understand that journey and also save up. And I will say the role of men throughout this antenatal journey is to not only save for what the mother is going to buy, it is also for any procedure within the hospital.
Okay.
Our government hospitals are available and are free, but in the instant that you need to get anything extra for your partner in hospital and for your baby, you need to have that money that is extra in the pocket. So sente za kasawo now become sente za what? Za antenatal. Eza kasawo, eza kameza azilekawo, na yongerako nezachi? Neza antenatal. And before, I like why you're doing this, because most young men think it's just a simple word. When we're talking to young people at the Ministry of Health, we always tell young people, if you don't have money for diapers for the first year of life for a baby, don't get a woman pregnant. Diapers are expensive. Someone will say, "Kati ate nappy ojazoza." But anyway, that is part of how men can be involved, of course, encouraging through, and also selection of the hospital where they are going to what? We are going to deliver together as they are with their partner.
Wow, very interesting. This has been short but very educative. Maybe as we wind up, just in a few seconds or a minute, if you can talk about 31st July, and then you give us your parting shot.
So thank you very much. The Ministry of Health will be holding its self-care event on the 31st of July this month. It will be held in Bunyoro region. region, the final venue will be communicated. And of course, the Department of Reproductive and Child Health encourages all men and their partners out there to make sure that you have safe antenatal and also visit the health facilities. They are open, they are available, and always seek consultation where I need to for a beautiful pregnancy experience in our hospitals. Thank you.
Thank you so much, Dr. Ruth. It has been really, really educative, and we appreciate your time and actually how you even came in very fast.
Thank you very much.
Thank you as well for watching us this evening. I want to appreciate you for sparing your time, and I hope you have had an educative show with you there. I want to bring greetings from Edwin Austin Mkalazi, but also the crew, Jonah Jal and Holmes are all sent greetings. My name is Luke Majumba. Have a good night.